This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Welcome to a beautiful Memorial Day weekend. It's great outside. What a gorgeous day. Absolutely perfect. Have an opportunity, get out and take a walk, go down to the parks, go downtown, enjoy yourself after you listen to Dr. Tom Roselle Live. Because I'm here for you, so you got to listen to me. Well, seriously, here, the whole point is that we want to make sure that you have the most intimate and updated information as possible when it comes to doing what you can to express your health at the highest levels as you possibly can, that your body's capable of doing that. You know, there's so many things that we have misconceptions about, and we're going to talk about one of the misunderstandings today, if you will. It's not a misunderstanding relative to our framework and our point of view, but so many people don't connect the dots. And what are we talking about? We're talking about blood sugar regulation and how it relates to a lot of different things, both mental, physical, and biochemical pain patterns. And to talk about that in studio, and your host this Wednesday evening, the 28th of the month at the Roselle Center for Healing, Dr. Leonard Poe. Dr. Poe, hey, hi.
Hey.
How you doing?
Good, how are you?
Good. You know, we're going to have a better day today. Matter of fact, your kids and my son's kids are going to the petting zoo.
That's right.
It's going to be a very nice afternoon. And you're going to have to chaperone all of them.
And lots of sunscreen, unfortunately.
Yes. And I will get there ultimately, but I do have International Applied Kinesiology phone calls to make today. But we'll get to that as well. Now, we're talking about a very important subject. We're talking about pain patterns and blood sugar patterns, and they're interrelated in so many different ways. Stress and diabetes is a topic that so many people have played with, touched upon, and I know that you're going to deal with that this Wednesday evening. But stress, both physical and emotional, mental, if you will, can send blood sugars way out of control, can take them right through the ceiling. So, you know, if you have diabetes, we're going to, or you're pre-diabetic, or you have even low blood sugar handling, because that's where it usually starts. This program is one that you really need to pay very, very close attention to today. We're going to really get down to the nitty-gritty, so to speak. You know, we live in a society that we're constantly pushing, we're constantly moving. Matter of fact, in the Washington metropolitan area, it's almost at breakneck speed, where, you know, something on a day-to-day basis happens, whether it's, you know, traffic, and, you know, we have these crazy people out there that, you know, want to cut you off and want to yell at you and then give you the Italian salute, and because, you know, you did something. But bottom line is that because of the things that we eat that we shouldn't be eating, things that we don't get, our stress patterns, our pain patterns, you know, we put up with, we take aspirin, we take all kinds of other drugs to modify, modulate, mitigate the pain, we get in trouble. And the end product is blood sugar handling. And that blood sugar goes crazy.
Lots of people, lots of problems with diabetes. We see it's on the rise. But lots and lots of people have those early stages of just poor blood sugar regulation.
Now, is diabetes an absolute situation? Is it something that it's all or nothing?
Depends, because there's different types of diabetes.
Okay, let's talk about them. That's called reeling you in, Dr. Poe.
There's the most common one, you know, when we talk about they used to call it adult onset diabetes. Now we call it type 2 diabetes. That's diet and exercise, and lots of other things. But that's changeable. You can get back from that.
But we're talking about stress. Diet and exercise is one thing, but if you don't modify the emotional stress patterns when it comes to blood sugar handling, that doesn't go away either. And we're not talking about anything that is over-the-top emotion. We're just talking about day-to-day stress, over-the-top, dealing with a mortgage that's over-the-top. We're talking about having to put up with your kids, your two boys, my grandchildren. Well, it's better you than me.
Well, let's be specific about it. It's what we're really talking about is your cortisol levels and your how you're adapting to stress and those hormones that are going out, because those things will interfere with your insulin and the way it's able to regulate that blood sugar.
Well, there's another hormone that we talk about, cortisol, all the time, and it gets a real bad rap because it's something that we need. Cortisol is one of those guys that we need to have in our system, but we don't want it way too high, and we obviously don't want to run our toenails.
Absolutely. No, that's something you have to explain to patients. There's nothing in your body that's really bad. You can have too high of anything, you have too low of anything, and that's cortisol.
But here's the other guy. It's epinephrine.
Yeah.
When epinephrine gets out of sync, we also have blood sugar dysregulation.
Mm-hmm.
So that still is an adrenal fight-flight function hormone that causes that.
Right, because we were only supposed to stay in that fight or flight for, seconds, not hours throughout the day.
So we're only supposed to chase the tiger for a little bit of time, and then
be chased by the tiger.
Or be chased by the tiger. Yeah, but sometimes I like chasing the tiger.
Yeah, you're up the tree and you're safe, or you're eaten.
That's true too.
But it's not supposed to be 8, 9, 10 hours a day in and day out. You lay in bed, you think about all the stuff you got to do tomorrow, and it's go 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 all the time.
Let's talk about a very specific portion. Let's talk about pain. Would pain be caused by high blood sugar levels, or would blood sugar levels initiate the pain?
Well, either or.
So how do they work?
Well, you can have pain for lots of different reasons. And
no, what I'm saying is that if you have pain, I understand that it's a Memorial Weekend, and I've relaxed for the last 2 days, which is a really good thing because I never do that. But if you have pain in your body, and obviously pain can come because of injury we put up with, we don't want to have to deal with. But how does that pain pattern ultimately trigger blood sugar dysregulation? I mean, people who have arthritis, we'll take it to that point, where they have problems with their neck, their hands, their back, and so forth. Then they go to the doc, and the doc says, "You got arthritis."
There, that's a better lead.
Okay.
There you go. Yeah, anytime you have any kind of pain patterns, anytime you have any kind of inflammatory patterns in the tissue, anytime you hurt, that's going to interfere with insulin and its ability to get that sugar into the cell properly. And you stick with that long enough, and you go through these phases of, you start with things like reactive hypoglycemia, and that leads into things like insulin sensitivity problems, and eventually things like diabetes. So the longer you're putting up with that, the longer you're running your risk of creating or becoming that full-fledged type 2 diabetic.
So if we follow the worm here a little bit, so to speak, if you have pain, you have problems with blood sugar regulation. We have a dysregulation, if you will, something that is unbalanced. So here's an interesting question. If you have a pain pattern, can normal blood sugar levels become cumulatively high? It's not by putting more blood sugar into the system.
Yeah.
But can they become cumulative?
Yeah, and that's why you never really, and I stress this to patients when we talk about blood chemistries, you got to be careful about just looking at that fasting blood sugar. You want to go and you want to measure things like hemoglobin A1C. You want to go and you want to measure things like C-peptide and see really in the big picture here, how's that blood sugar balance.
888-630-9625. That's 888-630-9625. My guest in studio, your host this Wednesday evening, the 28th of May. God, it's the end of the month already. 7:30 p.m. at the Roselle Center for Healing. Dr. Leonard Poe. We're talking about pain patterns and blood sugar regulation, or stress patterns as they relate to the diagnosis ultimately of diabetes. So if you have any blood sugar dysregulatory problems, this is an opportunity really to get a handle on it, to find out how you can fix it, what it really means. If it's pain triggered, you have a capacity in your body to minimize that, but it's not with drugs, it's not with putting up with, it's not with dealing those things. Also want to give you incentive, because it's a holiday weekend and we're kind of short on the week in our office. If you come to this presentation this Wednesday evening, the 28th of the month, May 28th, what we're going to do for you is simply this. if you come and you come to the class and you sign up for a very important event. It's called Ageless Health 2014 in October the 18th. It's a Saturday. What I'm going to do for you, but you have to do it this Wednesday evening, you have to be at the presentation, I will give you as my gift a copy of the CD, Health is a Do-It-Yourself Program. Ageless Health, Health is a Do-It-Yourself Program. My gift to you, if you come this Wednesday evening, the 28th of the month, and you sign up for Ageless Health and listen to Dr. Poe's presentation. And why are we doing that? Because it's Memorial Day, and we don't have a lot of opportunity to talk to you between now and Wednesday. So that's just the straight up and truth about this whole thing. So show up and sign up for Ageless Health 2014, and you'll get a copy of the CD, Ageless Health. Health is a Do-It-Yourself Program. Call our office, 703-698-7117. That's 703-698-7117. So, Dr. Poe, pain affects blood sugar regulation. So, slamming your hand on the car door, so to speak, or, you stub your toe, or chronic arthritic pain, any of those things are going to affect blood sugar regulation.
Sure.
And they can do it in the moment, or they can exacerbate something that you have that's kind of just sitting there.
Yeah, and when we start getting into problems with blood sugar regulation, you've got that insulin floating out there longer than it should, and you've got the blood sugar floating out there longer than it should. That starts creating pain patterns all to its own. It's very inflammatory for the systems, and a lot of times it's hard to get rid of that pain when you start getting in those stages of early onset diabetes.
Interestingly, you get into the literature, and there was an article in the Harvard Health Medical Journal, and it comes up, I think it's Harvard Health Medical Publication, something of that nature. And the question was simply straight up, high blood sugar, can it be related to pain? And this one doctor said, well, the jury's out, and we don't know if there's a direct link. And they said a person who's untreated or poorly controlled diabetic may have high blood sugar, and significant variations in blood sugar can also occur throughout the day, so they can go up and down, up and down. But they said that those fluctuations in pain, or blood sugar, not in pain, but in blood sugar, don't cause pain. Do you agree or disagree?
I think it depends on where you're at. It can certainly cause, depending on what your overall level is throughout the day. If it's higher than normal, then yeah, it's going to cause pain at times. That's when you're going to have, it's going to increase the inflammatory response in the joints. It's going to be more irritating. So sure, yeah.
Well, there's an interesting, they catch themselves, if you will, and there's a trap that they get themselves into, because there's something called syndrome of limited joint mobility, and it's a connection between blood sugar and joint pain. And they actually go and state in the journal that people with diabetes are at an increased risk of tendonitis, bursitis, plantar fasciitis, and other conditions that cause joint pain and instability.
Yeah, sure.
So there's the deal. When you have a problem with blood sugar regulation, you have more pain. When you have pain patterns and you have these problems because you went out and did something that you should be able to do, subsequently, now you have an increased risk of diabetes.
Yeah, you see it all how many patients have you seen over the years? I see them all the time where there's chronic pain patterns, and you really can't get that pain to go away completely until you do something about the blood sugars. You got to rein those guys back in, because when you're running around all day and your blood sugars are up 130, 150, you're going to be in pain. You're going to be in chronic pain until you bring those things back down.
Yeah, there's no disconnect from that. You have to. When you take a look at something called, we've talked about it many times, called Metabolic Syndrome, or Syndrome X, and that's when blood sugars go up and blood pressure goes up and cholesterol goes up. Pain drives all those pieces.
Yeah. Inflammation.
And inflammation, that's right.
Yeah.
And that's where it comes from.
Because the arteries are burning up.
And when they start degrading, when they start breaking down, nothing works in the body. We have this cascade that occurs because of that. We're here at 888-630-9625, 888-630-9625. Our presentation this Wednesday evening, the 28th at 7:30 p.m. at the Roselle Center for Healing, is on this subject, pain and blood sugar regulation, or blood sugar regulation and pain. And those of you who attend and ultimately sign up for 2014 Ageless Health presentation, October 18th, will receive a free copy of my CD, Health is a Do-It-Yourself Program. We're coming up for a break. We're talking about blood sugar handling. My guest in studio, Dr. Leonard Poe. Don't go away.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio. Happy Memorial Day, everybody. 888-630-9625. 888-630-9625. That's how you find us here. And if you'd like to get a hold of us off the air, go to rosellecare.com and send us a note. Or if you'd like to talk to any of us, you can always call us at 703-698-7117. That's the number that you would call and register for this Wednesday evening's presentation, May the 28th at 7:30 p.m. for Dr. Poe's talk on blood sugar regulation and pain, or pain and blood sugar regulation. It's an interesting topic because the two go hand in hand. Pain can be chronic. Pain can be specific. Pain can be not only physical, but it can be stress-related as well. We live in a very stress-ridden society, and all of those things can cause pain patterns, subsequently causing blood sugar problems. So, there was an interesting article, Dr. Poe, recently, and it goes back to 2013, and it was published in one of the more prominent journals, Health Daily News. And it said that an aspirin-like drug appears to lower blood sugar in people with type 2 diabetes. And it went on to talk about that it didn't have an effect on the diabetes itself, but it had effect on chronic pain patterns that people put up with, but more importantly, the inflammation that the pain caused. So what I'm looking for is...
I think there's probably better ways to deal with it than an aspirin a day.
I agree with you. The point of it is that the Harvard Medical School in Boston was the one that authored this thing. There was a guy by the name of Dr. Stephen Schulzen. He's a professor there, and he was talking about that relationship. But what they did see is that if they drop the pain pattern, the diabetes gets lower, or the blood sugars become more regulated. Mm-hmm. And that's what we were talking about.
Yeah.
So let's talk about pain and things that people put up with that ultimately gets them into a problem, because we have so many patients over the years that, show up and they've had pain, they've been putting up with pain, low-level pain, and they're taking stuff for it.
Yeah, just chronic. Chronic pain is the worst thing for it. I mean, everybody gets an injury here or there, and those things still need to be repaired. I mean, if you fall down, you hurt yourself, you lift something wrong, you hurt your back. I mean, those things still need to be repaired because they'll become chronic over time. But chronic low-level pain for years and years and years, that's, that does damage to it. That really starts to irritate that blood sugar regulation.
We deal with pain patterns of all different types in our practice.
We put it up and we cover it up all the time.
That's right. Patients come into our office and they've been complaining of headaches, migraines. They complain of, my big toe hurts, my knee hurts, my back hurts. When did you first do it? And when you really dig out, they talk about 20 years ago. And it's craziness. But, when you dig in and you start looking at all the information that's out there, and you realize that this type of straightforward, this is what's causing it type of thing, is been there for years. There was an article again published quite a while back, and it was quite a sizable study, 300 or so people, and it was between the ages of 18, I think, and about 70 or 75 years old, and these were people who had type 2 diabetes. And what they found is that when they could get rid of the pain pattern in the body, that across the board, the majority of them, their diabetic condition was, one, either far more manageable, but for the most of them had gone back into normal ranges. Yeah. And we deal with structural components that produce pain all the time.
Yeah, you hear it all the time, and you'll hear, it's not that bad. Well, it shouldn't hurt at all. I mean, that's the point. I mean, it's not something that should be manageable. It shouldn't be there.
No, and it really bugs me when a patient comes in and tells me that they're taking whatever it is for their I have normal headaches. I have
normal.
There is no normal headache.
There's no normal headache. A headache is telling you that anytime you have a headache, that's telling you there's something wrong.
Yeah, and if you sit there and you put up with it and you're not dealing with it appropriately, meaning get rid of it so it's not there anymore, finding what the why is that, the cause behind it. We talk about three things causing anything, structural injury, biochemical imbalance, and stress patterns. Those are the things that you have to look at, and particularly in the situation in a country that type 2 diabetic conditions are going through the roof, not only with adults but with children.
With children especially.
And children are in pain. Mom, I hurt. My body hurts. Yeah, it's growing pains. Well, growing pains are a result of an insufficient mineral content within the body that makes the bones ache. And unless you're supplying that properly, the child is going to hurt, and guess what happens? Their blood sugars go crazy as well. This is a very important topic, and we're going to get into it much more specifically when we come back after the break at the bottom here. This Wednesday evening, Dr. Leonard Poe will be your host, your presenter at the Roselle Center for Healing, 7:30 p.m. He's going to be talking about this topic, pain and blood sugar and pain patterns, one you really don't want to miss. And we have a very special incentive for you to be there. We'll be right back after these very important messages. Don't go away.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We've got one we're talking about that's very interesting, one that most people don't appreciate because they get caught in the trap of, it's just one of those things. Take these medications for the rest of your life and you'll get there. But with the rise of blood sugar handling problems, diabetes, and the what we call reactive blood sugar handling, hypoglycemia, low blood sugar, then hyperglycemia, high blood sugar, you really have to understand the why behind the situation. My guest in studio, your host this Wednesday evening, the 28th of May, 7:30 p.m. at the Roselle Center for Healing, Dr. Leonard Poe. We're talking about pain and diabetes or blood sugar regulation as it has to do with pain. So many patients, Dr. Poe, have chronic pain patterns, and it's in their spine, it's in their neck, it's in their hands, it's in their elbows, it's shooting, it's burning. They describe it sometimes as numbness, radiating, tingling, sensitivity to touch. And, the medical community wants to make it all about diabetic neuropathy instead of making it about pain patterns causing diabetes or blood sugar regulating. Let's walk through that matrix a little bit. Well, what I want to know is that, we're talking about, what came first here, the chicken or the egg.
Yeah.
And from our point of view, because we see pain so much, it often has to do with the pain first.
Right. And the typically, because by the time you get to that point, so much of that pain then, when you're in that full-fledged diabetic state, so much of that pain then is contributed because of the inflammatory response, because of the insulin or the lack of insulin and the overriding blood sugar. When you get to that place, you're not putting out something called C-peptide either, and that goes out alongside with insulin, and that's what really protects your neurons. That's what protects the vascular system from that inflammatory response. And so if you're not making insulin, you're not making C-peptide because they come from the same place, and we see those levels go down, and that's when the pain's really increased by the blood sugar. But there were reasons before that for pain that got you into that boat to begin with.
There's a term for pain called nociceptor response, increased nociceptor response. So that means that you have these receptor sites, that neurological receptor sites that are perceiving pain, and it registers in the brain, and that's what you have. And it has a very, very keen parallel relationship to being triggered by stress hormones, if you will, that were originally triggered by pain patterns.
Right.
And then subsequently you end up with, the stress, so to speak, causing your blood sugars to rise because you're in this thing called chronic pain. And chronic pain can be there because of an old surgery problem. It can be a blow or trauma, a car accident, anything about those.
Lots of things that, you've got it hurt and you never did anything to correct it.
Again, this Wednesday evening, the 28th, 7:30 p.m. at the Roselle Center for Healing. If you have blood sugar problems, if you're in chronic pain, and you're starting to watch your blood sugar levels start to go. By the way, here's the deal. What is too high blood sugar levels, Doc? What's the parameters? Where should they fall in? And when it gets above that level, you should start worrying about it.
Well, the kind of standard is anything over 99 or 100. Okay, that plus a hemoglobin A1C higher than 6, and you're in diabetes. But you need to start worrying a little bit before that and looking at the correlations between those two. I like to see it somewhere between 85 and 95, somewhere in there.
Well, you're a better man than I am because I don't even like to see it that high.
Yeah.
75 to 85 functional medicine normals in my book, and when we start breaking up over 90. That's a flag that says you got an inflammatory process.
And that's when you got to start looking at the hemoglobin A1C along with it. You got to start looking at the C-peptide along with it to really get an idea, okay, what's the insulin sensitivity? But yeah, when you start breaching that point, that's where you start to see some of that sensitivity going away.
The top end they're using now for A1C is 5.6, and it used to be 5.7. They keep dropping. One time it was 6 point. But here's a question for you, and as a toss-up. Pain can cause a shifting in A1C because it's an inflammatory marker, indirect marker, but it also, we're talking about, can cause blood sugar levels to kick up, right?
Yeah.
All right. So if you have a blood sugar level of 95, which is within the laboratory normals, but you have an A1C of 6.2, do you have a problem?
Yes.
Yeah. That's what I'm trying to bring.
And that's why you have to be. That's, and I'm going to talk about this some this week. But that's why you can't just go off that fasting blood sugar. It's not enough. You've got to be very careful about that. You want to look at all those things to really know from a functional standpoint, how's your blood sugar really doing?
This Wednesday evening, the 28th, 7:30 p.m., find out why your pain is driving your blood sugar and why your blood sugar is not going to get better unless your pain pattern's in control. Give us a call at 703-698-7117. Let's go to the phones. Hi, Bernice. Thanks for listening today.
Oh, thank you. I have a question for you about eggshell calcium. I've been washing out my eggshells, drying them, toasting them a little bit, like in the pan, and then I save them, but I wasn't sure if I should start taking it, but I've read on the internet that it's good for you. So what's your intake on that?
Well, anything other than a natural, organic form of calcium is not something that you should be putting in your body. Eggshell calcium, in theory, is a fairly decent calcium, but here's the problem. You don't have the enzymes to break it down. Unless you totally pulverize it and then put it in solution and so forth, you can't get it in your body. You don't have enough acid in your stomach to work on it. So your best calcium comes always from natural sources, things that your body can utilize. Years ago, if you asked me, how much calcium does a woman need, I would tell you probably in the neighborhood of about a minimum of 1,200 milligrams a day up to, God knows, maybe 1,800 milligrams. Now what we know, it's not about the calcium, it's about the utilization of the calcium that you're getting. As a matter of fact, too much calcium, unopposed, meaning not enough magnesium with it, can cause problems. So you want to see even much lower levels of a usable form of calcium from natural sources. And now we're not trying to fix a osteoporotic condition, but just in a general sense, you want to have it, in my opinion, 1 milligram of magnesium for every milligram of calcium. You want to have boron, you want to have selenium, you want to have K2. Those things will allow that to absorb. But more importantly, or additionally as importantly, you want to have enough hydrochloric acid production in your stomach, because if you're taking, for example, if you're taking a protein pump inhibitor, something that blocks the production of hydrochloric acid in your stomach, there's no way that you're going to absorb calcium or get enough calcium. You're actually going to go into a negative flow and you're going to pull calcium out of your bones. So it's about the balance of all of those things. I don't particularly care for the calcium that comes, if you're trying to supplement, that's coming from eggshell or oyster shell or any of those things.
It's calcium carbonate.
It's a calcium carbonate form. It's very, very hard for your body to deal with. Now, if you're going to change bone density, you want to use things like calcium citrate in conjunction with something called microcrystalline hypoxia-papatate, MCHC. Those types of calcium have a tendency to get into the system better, but you still need hydrochloric acid, and it depends on the body metabolism and individuality of it. I hope that helps a little bit, Bernice.
Yes, it does. What product on the market do you think would have all that?
That I can't tell you. If you want to get a hold of me privately, be happy to do that, but that's promoting a company, and I can't. Just send me a note, drtomroselle.com.
And could I get the calcium from vegetables?
Yes, matter of fact,
that's the best way.
That's the best way. Your vegetables have the highest source of usable forms of calcium. For example, a cup of cooked spinach has more usable calcium, than a cup of milk.
And you can get all the trace minerals along with it.
That's right. So,
okay, and that would help the bone, like somebody with osteoporosis.
Absolutely. But when you look at a plate, just as a general rule of thumb, I'm going to have Sue on here. We'll talk about it one day. But if you look at your dinner plate, half of your dinner plate should be loaded with green, colorful vegetables. 1/4 of it should be your dense proteins, and another quart of it should be can be a starch, but not a grain starch. You can have sweet potato or something of that nature. So that's how you look at it, just as a general sense.
So if I ate a cup of spinach every day, that would help my bone?
No.
I mean, that would get me out of osteoporosis?
No, you don't want to have a cup of spinach every day. You want to have dark green vegetables in varied amounts and different forms and different types.
And you have to remember, Bernice, that it's not all about calcium. There's a lot of other things that factor into osteoporosis as well. There's hormones that factor in. There's other minerals that factor in. Weight-bearing exercise. There's inflammatory alkaline acid pathways. There's a lot of different pieces.
Bernice, send me a note, and I'll get much more specific. Thanks for your call. I really appreciate it. Sandy, how can we help you? Thank you for calling.
Hey, in your comments about pain patterns causing blood sugar levels to go up, I was wondering, can you decrease the pain pattern by regulating the blood sugar through nutrition?
Good question. In some situations, the answer is yes, because when you get into a diabetic neuropathy, where because of the blood sugar problem, the inflammatory levels start getting high. That's when you truly get an endpoint. The burning, the pain in the hands and the feet, that sort of thing. But generally, that's a secondary manifestation of what, you still got to go back to the blood sugar. What's causing that to begin with? Was there a structural problem? Was there an injury at one time? Is the stress levels just over the top? Biochemically, my mantra, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, is that kind of stuff that's causing, the blood sugar handling problem? So the short answer is yes and maybe.
And that's why it's so important. You got to look at the whole body. You got to look at everything going, all the different factors going on to see, what's the main component here? What's the primary issue?
Okay, thank you very much.
You're welcome. Bill, thanks for calling. How can we help you, sir?
Doctor, I had what the doctor called a severe gout attack in my right ankle, and it swelled up and very painful to walk on. I went to their Friday, and they gave me allopurinol, indomethacin, and meloxicam. And I was just wondering if there's any alternatives to using those medications.
Oh, yeah, absolutely.
Diet.
I mean, diet and exercise. What you get with gout is a failure of liver functions, purine metabolism problem in the body. And if you clean out the liver and you start eating properly, and you get away from the shellfish, high density red meats, stay away from the alcohol, get away from certain bean products, and so forth.
It's the king's disease. It's all the rich foods.
It is anything that's processed, sugar.
Well, I don't add sugar to anything. I don't eat red meats. I don't have sweets. I don't.
You drink a coffee?
Have 2 cups in the morning.
Okay. Get rid of your coffee. And do you drink alcohol of any kind?
Yes.
Okay, get rid of the alcohol. That's number one. You have to get rid of alcohol and gout. Otherwise, it'll never go away.
Okay. Well, apparently, my uric acid is 9.8.
Yeah, you're pretty high. You got gout flare. And the problem with gout is these little uric acid crystals will get into the joints, and they'll start damaging and ripping up the joint spaces, including in the spine. There's a very specific way. The gentleman called in several weeks ago and put me on notice with something that I had no knowledge of, and it's the Jamaican guinea hen tea. Yeah,
I remember that.
Yeah, we actually ordered some, so we're going to start testing it in the office to see how it works. But we're going to get the organic.
Where can I buy that?
We got it online. Just look it up, and it's there. But the interesting thing, as I said a week or two ago, is that after all the research that we did on it, it's good for a lot of different things, but it said nothing about gout.
Yeah, I know. I sent you research on it.
Oh, you're the guy.
Yeah.
Oh, okay. Well, you still got the gout. So here's.
I wasn't the guy that called in.
Okay.
I sent you the research the next day.
No, I do. I remember that. And like I said, I get names mixed up. But here's the situation with gout. There's some natural things. If you clean the diet up, and you get rid of the alcohol, you get rid of the coffee, you get rid of the fast foods and the sugars and so forth. You start out and start getting some exercise on a regular basis. It doesn't have to be heavy. Just go for a walk 2 miles every day. Drink enough water, good water, to filter the accumulation of the uric acid in the body. Black ox heart cherry juice is one of the things that has always been very effective with gout flare-ups.
Without added sugar.
Just plain. Ledum
and milk thistle and red yeast rice.
Milk thistle will help. Not so much red yeast rice, but milk thistle will help because it clears out phase 1 cytochrome P450 liver filtration. The other there's a homeopathic called Ledum polester that has been known to help gout as well. But anything that you can do to reduce the high purine foods in the body, those are the things that are going to make a difference. But basically, any alcohol whatsoever, the things that we talk. Do you eat shellfish of any sort? Anchovies?
No, absolutely not.
Sardines?
Nope.
Okay, you're not Italian.
Nope.
But stinging nettle will also help. Celery juice will help. Ginger will help. All of those things can make a difference.
You got to get that vascularization opened up.
That's right.
Manipulating the ankle joint, getting that mortise joint opened up to free up the vascularization and get those crystals to move.
In acupuncture,
how do you manipulate the ankle joint?
Just
come see one of us.
And the reason that he's talking about that as well is because the acupuncture channel for the liver starts on the big toe and it flows all the way up in the chest. That's why that the majority of gout attacks start in the big toe. Take a good high level of B complex with folic acid. About 400 micrograms of folic acid should be sufficient. Gout pain is always there, and it's it's one of those nasty, ugly things unless you treat it properly. By the way, any of the berries, and my brain's starting to work on your problem now. Any of the berries, blueberries and boysenberries and blackberries and strawberries and things like that, are very helpful in gout as well. They they bring down the uric acid level. They actually work the step before that and work on the purity and metabolism.
I have 1 or 2 servings of blueberries or strawberries every single day.
Good. Now fix the rest of it, and you should be in good shape. Bill, we're coming up to a break. Thanks for your call. I really appreciate it. My guest in studio, Dr. Leonard Poe, your host this Wednesday evening at 7:30 p.m. at the Roselle Center for Healing. He's going to be talking about pain and blood sugar regulation. Don't go away. We'll be right back.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. We've been here at 888-630-9625 like we are every Sunday at 12 noon, bringing you the most intimate and updated information on natural therapeutics and the things that you can do for all the problems that you have in your body. This Wednesday evening, May 28th, 7:30 p.m. at the Roselle Center for Healing. Dr. Leonard Poe will be your host, your presenter. He's going to be talking about pain and diabetes, or blood sugar regulatory problems, or blood sugar regulatory problems and pain, whatever came first, the chicken or the egg. But listen, this is something in both situations that if you understand the patterns, you can do something about. And I want to incentivize you to come. October 18th, 2014, Ageless Health is a presentation we've been doing for 13 years. Those of you who have attended know that it's over the top. You have an opportunity right now, by the way, to register at a huge discount, $59, and it includes an organic lunch, and it's all day. It's over the top. After next month, it goes up. So I would encourage you to go to our website. But here's the deal. If you come to this Wednesday night's presentation and you sign up Wednesday evening there, you'll have the opportunity to do that. I will give you as a gift from me to you the CD version of my book, Health is a Do-It-Yourself Program. So join us this Wednesday evening, this Wednesday evening, May 28th, and sign up for Ageless Health presentation October the 18th. And I will give you as a thank you, a gift for coming, a copy of my CD, Health is a Do-It-Yourself Program. So give our office a call. It's 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there. We only have a few minutes, but I'm going to go to the phones. George, how can we help you?
Hey, Dr. Roselle, always good to talk with you. I just heard that gentleman with the gout problem again, and I have to say, I probably have turned 50 people onto your program there since, I like what you say and whatever.
Thank you, my friend.
And with the gout thing, there is one thing you can take, trash allopurinol and everything. I've done all that stuff. There is a green pill. I don't know the name of it. If you're in a gout attack, it smells terrible and it tastes terrible when you take it. But overnight, my gout was relieved overnight from this pill until I got off those pills.
What is it?
I don't know the name of it. I looked at my car here. I know. The one kid that he described, it wasn't.
When you put something on the table like this, and you tell me first you incentivize me to do homework and research, like the guy did a couple of weeks ago with the Jamaican guinea hen tea. I need to know this stuff. You got to come up with the data.
Well, Dr. Roselle, I'm telling you, this is no lie. I have taken every trigger food that I used to eat just to see if I can get gout again, just to see if
George, I got to cut you, man. We got to end the program. Give me a call. I'll talk to you later. You've been listening to Dr. Tom Roselle live. Have a very happy Memorial Day. See you next week. Bye.